Hello, my name is Marna Escobedo, and I'm going to be presenting my questions MBCOT style for the radar approach and domestic abuse. So it's going to be the question, the answer, and the rationale. During an occupational therapy assessment, a client presents with unexplained injuries and avoids talking about their home. What does the letter A in radar specifically address in the context? Anxiety, abuse, arousal, or assertion. The correct answer would be A, abuse, because due to the recognition of the signs such as unexplained injuries and the avoidance of talking about their home environment, this could be related to domestic abuse. The second one is, which of the following is a key component of the A, which is as, step in the radar approach for domestic abuse? Ignore the situation, directly accusing the individual, asking open-ended questions, or assuming the problem will resolve on its own. The correct answer would be asking open-ended questions, letter C. The rationale to that is, and the A in radar stands for ask, so it is important to ask the client open-ended questions to gather as much information you can about the situation. Number 3. Which of the following describes the radar approach in the context of domestic abuse? A method for tracking weather patterns in domestic violence or prone areas. B, a comprehensive approach for assessing and responding to domestic abuse. C, a technique used by law enforcement to monitor high-risk domestic offenders. Or D, an acronym for reporting, advocacy, documentation, and restorative justice for domestic violence. The correct answer is B, a comprehensive approach for assessing and responding to domestic abuse situations. So the radar approach is used to help identify and address domestic abuse. The radar approach helps guide you in a situation of domestic abuse to gather further information. Number 4. A client who presents with physical injuries and just presents differently at the session has been asked about the injuries and her answers are inconsistent. The therapist suspects that there are signs of domestic abuse and uses the radar approach to gather more information. The client denies this and states that there is no domestic abuse happening. You proceed to document all information. What role does documentation play in the radar approach? A, it serves as a legal record for the prosecution of the abuser. B, it is unnecessary and can compromise victim confidentiality. C, it helps in gathering and organizing important information related to the suspected abuse. Or D, it is solely to satisfy administrative requirements. The answer is C, it helps in gathering and organizing information related to the suspect abuse. So the radar approach is a very important tool that is used to gather information again and document this. And this can help assist the client. And it can also help other healthcare members just read up on the chart and see anything going on with the client. Number 5. In the radar approach, why is it crucial for occupational therapy practitioners to recognize signs of domestic abuse? A, to punish the abuser. B, to support the victim's coping mechanism. C, to maintain professional boundaries. D, to validate the abuser's perspective. The answer is B, to support the victim's coping mechanisms. The rationale is because the radar approach is important because it can help the therapist find ways to direct questions to the client. After gathering information, the therapist can use this information to help the client find different coping strategies. Number 6, during the R step of radar approach, what should occupational therapy practitioners prioritize? Encouraging the victims to take legal action, reviewing personal biases, referring the victim to counseling support groups or any community resources available, or recommending the use of self-defense mechanisms. The correct answer is C, referring the victim to counseling support groups or any community resources available. The rationale is because all of this information can be very useful to the patient, client, and so within the referral, you can give them any availability and any easy accessible to community resources to the patient. Number 7, which of the following is not a common sign of domestic abuse if you're following a radar approach? Unexplained injuries, frequent emergency room visits, isolations from friends and family, regular exercise routine. The correct answer is D, regular exercise routine. Signs of domestic abuse can be unexplained injuries, frequent visits to the ER, and isolation from friends and family. But having a regular exercise routine determines more of a structured routine, and that is typically not a sign of abuse. So number 8, a new therapist is working with a client who they suspect is suffering from domestic abuse. The therapist is planning to use the radar approach. What is the role of healthcare professionals in the radar approach? A, providing therapy for the victim. B, acting as a mediator between parties. C, recognizing signs and intervening appropriately. Or D, recommending legal action. The correct answer is C, recognizing signs and intervening appropriately. Rationale. Because the role of healthcare workers is to recognize this, any signs that are going on of domestic abuse, and help guide the patient. So help intervene correctly and appropriately for the patient and give the best help that you can. So what should be considered when developing a safety plan and the radar approach? The client's preferences and input, legal consequences for the abuser, assigning blame to both parties, minimizing the victim's involvement. The correct answer is C, the victim's preferences and input. The rationale is because when you're creating a plan, it is important to ensure that the client is adding in their own preferences and input to make this more client-centered. Number 10, a client has discussed domestic abuse that is going on within her home to the therapist during the session. The therapist has to document the information for the patient that has stated. What would be the next step? Document the information, assess the client's safety, inform the client to call the proper authorities regarding the situation, or dismiss the client's concerns and change subjects. The correct answer is B, assess the client's safety. So once you document the information, the next step is to assess your client's safety, make sure that they have a safe place to go home after, or find out what is happening, find out if there is violence that is escalating, or find out if they are in harm. And I do apologize for the mistakes that are here. But thank you guys. This is my quiz. I hope you guys learned a little bit from my video and my quiz. And thank you.